The CORALLEEN trial was a study aimed to ask the following clinical question, and that is, within hormone receptor positive HER2 negative breast cancer with the luminal B subtype, a group of patients where most of the time we give neoadjuvant or adjuvant multi-agent chemotherapy because of the high risk they have and because they respond more to chemo. The question was, in this group of patients, if we could find a way to get rid of chemotherapy. And in order to do that, we designed this trial, which was a prospective trial, neoadjuvant, of 101 patients. Patients were selected based on classical clinical criteria, hormone receptor positive, HER2 negative. They were all postmenopausal with tumors above 2 centimeters. And we performed a PAM50 assay to make sure the tumors were luminal B. If that was the case, patients were randomized to 1-to-1 to chemotherapy, standard anthracycline taxane-based chemotherapy for 6 months, versus a strategy of no chemotherapy, a strategy of endocrine therapy together with Ribociclib, a CDK4/6 inhibitor. We gave the 2 treatment strategies for 6 months, and then surgery was performed. The overall objective of the trial was to see in what proportion of cases we could change or we could transform a luminal B tumor to a low-risk luminal A tumor at surgery after 6 months of therapy. This trial was not aimed to compare head-to-head the 2 arms. It was just a descriptive study to describe what was the percentage of tumors that became luminal A low risk at surgery. And what we showed is that, strikingly, in around 45% of the patients, the tumors went from being luminal B before therapy to being luminal A low risk at surgery. And this happened, the proportion, in both arms. So the study doesn't change clinical practice. The study, what tells us is that potentially in the future, we could be using CDK4 and 6 inhibitors to give less chemotherapy or no chemotherapy at all. The current phase 3 clinical trials, the pivotal phase 3 clinical trials with CDK4 and 6 inhibitors in early stage breast cancer, such as PALLAS, Penelope-B, Natalie, these studies are adding CDK4 and 6 inhibition on top of chemotherapy and endocrine therapy. Here, the strategy would be different, would be to try to restrict or even eliminate chemotherapy in this group of patients. Of course, CORALLEEN is not definitive. We need a follow-up trial that clearly shows that this strategy is useful and that the long-term outcome of these patients without chemotherapy is optimal. And I think this is something that we're trying to pursue in the near future.